Without further ado, I would like to invite our guest speakers to share with us some brief introductory remarks. So we have both Josh Josa and Catherine Guernsey in the room, and Kathy is going to speak for us first. As an introduction, we're just so happy that Kathy is here. She is our Agency Disability Rights Coordinator, and she's responsible for advising the agency on disability inclusion at both the program and policy levels. She manages the agency's Disability Program Fund. She's a public and international lawyer who has dedicated her career to the field of human rights with an emphasis on disability inclusive development and diplomacy. Kathy, we would love for you to come off mute and give us some introductory remarks, and then I'll follow up by introducing Josh Josa. Go ahead, Catherine.
Good morning, everyone. Hopefully you can hear me okay. It's a real pleasure to be with you this morning, albeit virtually. USAID has a long-standing commitment to disability inclusive development. With its adoption of the USAID Disability Policy Paper in 1997, USAID became one of the first bilateral development agencies in the world to commit to prohibiting discrimination and actively promoting inclusion of persons with disabilities and their representative organizations as essential partners in the development process. As recently noted by outgoing USAID Administrator Mark Green, disability inclusive development is a critical part of any country's journey to self-reliance. For that reason, USAID is striving to include persons with disabilities across all of our projects and portfolios, including in the area of education. Education is arguably the vector for all social development, and its importance is only heightened in the current context of the global pandemic, especially for students with disabilities who can least afford to be left behind in the pivot to remote and distance learning modalities. Data collection is a critical tool that we can use to secure positive outcomes for learners with disabilities, to let us know what's working, what's not, and adapt and scale up accordingly. We have a terrific group of presenters today, and I'm excited to learn what they have to share. I also want to give a special thank you to E3Ed for your enduring leadership in promoting disability inclusive development. You are truly a model for the agency as a whole. And lastly, I'd like to thank all of you for joining today's workshop and for your continued efforts to strengthen education systems worldwide so that all children, including children with disabilities, can learn, grow, and thrive. Thank you.
Thank you so much, Catherine. We are so happy you're here joining us today, and thank you for kicking us off. Next, I would like to bring Josh Josa to share a little bit more about USAID and our support to this project. Josh Josa is a disability inclusive education specialist. He's the acting Quest team lead, and he leads the disability portfolio at USAID's Office of Education. In his current role, he focuses on working with USAID missions and Washington to ensure education programming quality, equity, and sustainability, as well as the inclusion of people with disabilities throughout the education system. He's worked for USAID since 2014 and is also a returning Peace Corps volunteer serving in Kenya from 2010 to 2012. Josh, I invite you to come on the screen as well as off mute to share a little bit more and to kick off our session.
Good morning. Good morning. It's wonderful to see all of you. And the voice you will be hearing is my ASL interpreter. So I'm so excited to be here and moving forward with this process. I want to open by thanking all of those our presenters that we have today. Dan Mont, Claudia Kappa, Mitch Loeb, and Ann Hayes. I really want to thank the four of you for your participation, and the team from Encompass who has led and worked this project through the USAID DEEP program. A huge thank you to both of those groups. I also would like to provide some special recognition to Amy Mulcahy-Dunn. She is the DEEP Chief of Party, and as well as Dan Mont. The two of them have provided a lot of guidance and support through all of our work, so thank you to both of you. I'm not sure where all of you are on the screen, so I'll just say thank you to everyone. And I really want to emphasize USAID's commitment to safety and equity and quality within all of our education programming, within our priority areas, and encouraging that work moving forward. Trying to support local initiatives and transform that. We really want to reach those most marginalized populations and support them within our programming at all levels of the education system. Many of you are probably aware that USAID is part of a large donor group, the Global Action on Disability Network, or GLAD, and they provide key information. I think we can jump to the next slide with our infographic. Would you mind going to the next slide? Thank you. That info, yep, there you go, great. That infographic, oh. On this slide, this is the GLAD Network's infographic. We came to a consensus on the key information here that you see on the screen. You can look through that after at your leisure. We'll send you a link to all the slides. But the one message we really want to emphasize here and highlight is accurate data on children with disabilities, and that is disaggregated by gender, age, disability type, as well as school level, education level, and providing access to teacher training. All of these pieces are really necessary to make sure that we are doing accurate funding and investment at every level of the education system. Now, you might wonder why USAID started this DEEP project and how we plan to use this information. The USAID Office of Education is really committed to collecting and analyzing disability data within the education programs to make sure that all of our work is inclusive of students with disabilities and that we are meeting and supporting the education policy priority. And we can expand on that to talk about how we need to provide access to education for all populations, including those most marginalized. And that starts with collecting disability disaggregated data for all programs. And that guidance really has really been driven by the Washington Group tool. And that tool is wonderful. We collect data on children with disabilities from the family. And we get that data from the family from those who are within the USAID program, but it's not always successful within all contexts where we work. And so the challenge then becomes, how do we get to the information that we need? So working with our partners and the disability groups, at the end of 2019, we decided that we would go ahead with this tool to try and find all the various levels of education programming and how that disability data is being collected. And we started this study under DEEP to collect information from our partners. And I want to thank all of you for all of the tools and the approaches that you shared and with us. And we've noticed that the most important lessons learned from this will be applied to the tools moving forward. And all of the information that we have collected from our partners including what we hope to learn from all of you today, that will affect future guidance and how USAID proceeds with our programming. Specifically, we're hoping that information will improve guidance in terms of disability data collection for early grade reading programs. And finally, I would really like to thank everyone who has joined the session today, and thank you for your participation. I wish we all could get together in person and see each other, but this is what we have to do right now. So again, thank you for working through all these technology platforms and meeting here with us today. USAID is very proud to work with all of you and promote more equitable, quality, inclusive education for children all around the world. So thank you, and I really look forward to working with all of you in the sessions today and talking with you. Thank you.
Thank you so much, Josh, for that warm opening, as well as to Catherine. We really appreciate all of your words and your support for this process. And as Josh mentioned, thank you to everyone for joining us today. We're going to switch screens, and we will be going into our first activity, which is an opportunity to hear from you about the reasons that you use data, so what the purposes are. We understand that there's a variety of reasons why organizations and people use data. You'll see on the upper left-hand side of your screen, there's a poll that has a variety of reasons and space as well below for you to share other purposes for utilizing data. We realize that these are not replete, that there are many reasons why we use data above and beyond this poll, but we welcome you to add some of your ideas below as well. So we wanted to identify some of the large buckets for purposes, and if you could please add a check mark to any of the reasons why your organization currently uses data, we welcome you to do so. I'll be reading this out so that people can contribute to the poll. So the question is, for what purposes do you collect data on school-aged children with disabilities in your current role at your organization? Answer 1, to develop national and regional benchmarks and prevalence rates, document disability gaps, and monitor progress across countries. Option 2, to monitor equity and inclusion of program implementation. Option 3, to monitor learning outcomes among children with disabilities. Option 4, to determine the types and quantity of necessary services and supports for the target population. Option 5, to raise awareness and support regarding reasonable accommodation approaches in schools and/or budgetary requirements of inclusive education. Option 6, to identify individual children who need support. So please feel free to put a check mark in any of the options that you utilize in your work. If you would like to add additional ideas, you can put them below in the chat box. I'll give you a few minutes to complete the poll or to add your ideas. If you do need support in utilizing the poll, please add any ideas into the chat pod, and we can help you by clicking in the poll follow. I can see people adding a few ideas below in the chat box. For instance, to identify children who are out of school and barriers that keep them out, to support national benchmarks and input to national statistics related to disaggregated data, to obtain a clear database of numbers and location for ease of reaching them, to make comparisons of certain outcomes between children with and without disabilities, to support targeted advocacy with governments for improved policies, resource allocation, to help countries develop national ECI and ECD policies and education and action plans, to advocate for legislation and policy, to help nations develop indicators for monitoring and evaluation frameworks. And I see above in the poll that many options were chosen and that really there's quite a large number for each. So we have to develop national and regional benchmarks and prevalence rates, document disability gaps, and monitor progress across countries at 60%, to monitor equity and inclusion of program implementation at 82%, to monitor learning outcomes among children with disabilities at 84%, to determine the types and quantity of necessary services and supports for target population at 42%, to raise awareness and support regarding reasonable accommodation approaches in schools and/or budgetary requirements of inclusive education at 54%, and our final category, to identify individual children who need support at 43.1%. Now we realize that these numbers may not include every reason that we utilize data or the purposes for which we utilize data. The point of this exercise is really to just recognize that there are a variety of reasons that we each collect and use disability data in the education sector. And the tools we choose to use should match the clear purpose, which means that we need to really think of a broad range of parameters for selecting assessment tools. And that's the main reason why we're here today, is to be thinking about that selection of tools and selecting those tools to meet the purposes for which we utilize data. It's really unlikely that a single tool will fit every purpose. With such a variety, we really want to think through how to determine which tool is most appropriate for each purpose that you have. Thank you so much for participating in our poll and for adding your ideas here. We really have so many ways that we utilize data, and we want to be able to think very strategically about which tools we're going to be selecting. So I'd love to change screens and move to our next section of our session. And I want to welcome our guest technical experts to the room. So today we have four invited guests who are going to be supporting us as we discuss the tools that we use when we are collecting data. And so I welcome Claudia Kappa, Michael Loeb, Ann Hayes, and Daniel Mott. I'm going to start by introducing all four of our speakers, and then I'll be asking each one to come off mute and share a little bit more about their technical expertise and about some of the tools that we have been looking at through the research that we have done for the current report. And then following that, Daniel Mott will also be presenting some of the information that was included in the report. So first off, I'm going to introduce Claudia Kappa. She is a senior advisor for statistics, data, and analytics section at UNICEF. She's the focal point for data collection, data analysis, and methodological work on child disability, early childhood development, and child protection from violence, exploitation, and abuse. She represents UNICEF and the Washington Group on Disability Statistics. Next, we have Mitch Loeb. He is the Disability Data Advisor to the Washington Group on Disability Statistics. And he has several years of experience in the field of health sciences, focusing particularly on disability, functioning, and health. Prior to his formal retirement in 2019, he spent 12 years at the Department of Analysis and Epidemiology at the National Center for Health Statistics, Centers for Disease Control and Prevention. In addition to his work in the U.S., he has carried out epidemiologic research in Canada, Norway, and several developing countries in sub-Saharan Africa and Southeast Asia. He continues his international commitment to the development of culturally comparable disability measures through his work with the Washington Group on Disability Statistics. We also have Ann Hayes. She's the co-founder and chief operating officer of Inclusive Development Partners. She's the co-founder, and she has more than 25 years of technical expertise focusing on disability, inclusive development, and inclusive education, working in more than 30 countries worldwide. She's a lead author of the USAID's Toolkit to Promote Literacy for Students with Disability, and worked previously as the Director of Collaborative Initiatives at the World Bank's Global Partnership on Disability and Development, and as a Disability and Gender Specialist at USAID. She's participated extensively in NGO efforts related to the drafting of CRPD as a steering committee member of the International Disability Caucus. And then finally, we have Daniel Mont. He is the co-president of the Center for Inclusive Policy. He has extensive experience in the area of disability and inclusive development and has worked as a senior economist with the World Bank and a wide range of other international development agencies, governments, and civil society organizations. He serves as the chair of the UN Statistical Commission's Washington Group on Disability Statistics, Analytical Working Group, worked with UNICEF and UNESCO on building inclusive education management information systems, as well as with UNDP, OHCR, and ESCAP on developing indicator frameworks for reporting on the Convention on the Rights of Persons with Disabilities. We're so thankful to have our 4 presenters here today, and I'd like to ask each one by one, to come off and tell us a little bit more about their technical expertise and some of the tools that we'll be speaking to today. Claudia, I welcome you to come off mute and share a little bit more.
Actually, we had an order that we were going to speak in, so can
I apologize.
Jump
yes,
in?
Daniel, go right ahead. Thank you.
Yeah, yes, all 4 of us have a lot of experience in collecting and analyzing data on disability. But what we're going to do in this session is basically lay out some of the primary tools that are part of our decision tree. And the first one is the Washington Group short set. Now, back in 2002, the UN Statistical Commission realized that the state of disability data was not very good, and convened the UN Washington Group, whose members are members of national statistical offices from around the world. And the first goal, the first mission of the group, was to come up with a short set of questions, the shortest set possible, to in an internationally comparable way, accurately identify people with disabilities in the population. And the Washington Group short set are those 6 questions. And they take a functionally based approach. They don't ask about disability. They ask about whether people have difficulty doing some core basic activities. And there's a lot of strengths to the Washington Group questions, but of course, disability is a very complicated, very involved area, and it's hard to imagine 6 questions fulfilling every purpose for collecting disability data. And 2 of the areas that are gaps or shortcomings in the Washington Group short set were its ability to identify children with disabilities and its ability to look at psychosocial issues. So after doing the Washington Group short set, the Washington Group developed an extended set that got into some of these issues in more detail, with more of a focus on adults. And then we developed, in partnership with UNICEF, the child functioning module. And Claudia is going to sort of lay out a little bit about what the child functioning module is. So now I'm going to hand it over to you, Claudia.
Thank you very much, Dan. It is my pleasure to be joining this workshop today, and particularly speaking about the work that we have done with the Washington Group on Disability Statistics since 2011 to develop the child functioning module. As Dan mentioned, the child functioning module was developed in direct response to the need of developing a tool that could capture difficulty in functioning among children. So it is a work that took place between 2011 and 2016. So it took us 5 years of work because, of course, capturing difficulty in functioning among children is particularly complex for a number of reasons. Children are in a constant process of development, so it's particularly difficult to distinguish between normal pace of development and difficulty in functioning, for instance. Also, the questions that are able to capture difficulty in functioning among children needs to be, of course, age specific, and therefore we need to develop a set of questions that work well for children under the age of 5, for instance, and this set will be different, of course, for the question that we would use with an older population of children. And therefore, the questions that are meant to be used for adults we cannot assume that they will work specifically for children and vice versa. So for developing the child functioning module, the rationale was to develop an instrument that can allow us to identify children with functional difficulties. Now, these children in an unaccommodating environment are at risk of experiencing limited social participation. So we use very much the International Classification of Functioning as the model for developing the child functioning tool. The aim of the child functioning instrument was to be able to provide cross-nationally comparable data. This is an instrument that is meant to be used in population-level data collection to give an overall sense of the proportion of children in that population which have functional difficulties. It's an instrument that was originally developed to be used as part of household surveys, either dedicated disability surveys or general surveys that could collect data from parents on children. So the original intent was to have a module that can capture functional difficulty in children, and that was meant to be administered to the mother of children aged 2 to 17. If the mother is not alive or not present in the household at the time of data collection, for of course because not residing in the household, then a second primary caregiver is identified. But the module was truly developed with this specific intent in mind: population level measurement of difficulty in functioning among the child population aged 2 to 17, having as respondents the mothers, or if the mother was not alive or not residing in the household, primary caregivers. Because we had this specific objective measurement objective in mind and a specific data sources as well in mind, we ran a number of different tests to validate the instrument. And what we did specifically was cognitive testing first, meaning a test that is really meant to evaluate whether respondents are able to understand the questions in line, consistent with the original intent of the question. And they're also able to provide response to this question that are again consistent with the original intent. Through cognitive testings, we have been able to identify issues related to, for instance, interpretation of questions and responses that were not in line with our objective of capturing functional difficulties, but were indicative of other, for instance, issues that we were not willing to cover with this instrument. Then, of course, we did field testing to test the implementation aspects of the modules, and actually we did so with a random sample so that we can test whether the module was performing well with respect to, for instance, identifying children with functional difficulties according to certain background characteristics of the child and his or her family. So, for instance, we collected information that allow us to verify whether the module was providing the level of differentiation and variation in prevalence of functional difficulties depending on the characteristics of children, for instance, being from a healthy, wealthy households versus a poor household. So the module currently covers a large set of domains, and that's particularly important as we talk about the relevance of this instrument within the context of education. because the domains of functioning that are covered in the child functioning module for children of school age, so children age 5 to 17, goes from the more traditional domains of functioning, like for instance mobility and hearing and vision, to other domains of functioning that have been historically overlooked in data collection on children with disabilities, but are very, very important when it comes to understanding the full spectrum of functional difficulties that children might experience, particularly in the context of learning and education. So the child functioning module capture, for instance, affect and emotion like anxiety, depression, the ability of the child to concentrate, to learn, to making friends, to controlling his or her behavior. But we also have a set of questions related to communication, remembering, accepting change, in addition, again, to the more traditional domains such as hearing, vision, and mobility. And when we compare the results coming from the Washington Group short set and the child functioning module for the same population, and we did so as part of our testing, we can clearly see that the child functioning module is likely to produce results and prevalence level that can be 2 to 3 times higher, because we are capturing, of course, a broader range of domains that are particularly, again, important when it comes to school and learning and relationship, which are not covered as well in the Washington Group short set. I'm going to stop here. I know that Mitch is going to take over and talk about the child functioning module with respect to teachers, but of course I will be happy to answer any other question you might have.
Thanks, Claudia. And hello, everybody. It's good to be here, and thanks for inviting me to participate in this seminar. As Dan and Claudia have both introduced tools developed by the Washington Group in collaboration with UNICEF, I think both of them highlighted the fact that these tools were developed for data collection in national household surveys or censuses. So large representative samples. Claudia highlighted the differences between collecting data on children compared to data on adults. And one thing that we have to take into account is the fact that children exist generally and universally in 2 very different environments. One is the household environment, where the mother or primary caregiver can be a reliable informant on child's functional abilities. But at children, all school-age children, as is in the language, go to school, and the classroom is another environment that is important to take into account for collecting data. When the Washington Group was approached to look at a modification of the child functioning module for use by teachers, we took a close look at what we had, and we had to look at the difference in the environment. Rather than a household survey where we're asking a mother about her child or children, that could be 1 to several. It's different in a classroom where a teacher has perhaps 15, 20, 30, 40, or even more. I've heard of classrooms with over 100 children. So we have to take into account the workload of teachers in being able to answer questions on individual children and their functional abilities. The other thing is when to approach teachers. Do we approach teachers at the beginning of the school year, the middle of the school year, the end of the school year? We want to be able to ensure that teachers have a good idea of individual pupils' abilities. So that's something that has to be taken into consideration. Another aspect is, sorry, just trying to get my thoughts in order. Understanding the teacher's ability, their time, and their competency in answering these questions. There is anecdotal evidence that is probably in the literature as well that some children aren't identified as having difficulties in, for example, seeing and hearing until they get to school. So it is an important arena for collecting information. We have a version of the child functioning module that is ready to be tested in the field. And we are partnering with UNICEF to get that done. So I can give you more information on that. It's a one-page survey tool that includes almost all of the same domains of functioning as in the full child functioning module. So it's quicker and easier to use by teachers in a classroom setting. I think I'll leave it there for now. But again, as Claudia said, happy to answer any questions you might have. Thanks, and I'll pass it on to Anne.
Hi, everyone. Thank you so much for having me today. What I'm going to talk about is really more of the identification for services. So once a child is identified with the end goal being supporting that child in the classroom, and this is very different than the Washington group scenarios because it starts with universal hearing and vision screening, and that's important because that has to be ruled out before you can do any other type of screening, in particular for children with intellectual or cognitive or learning disabilities. They have to rule out vision and hearing. And then, you know, to be honest, we still don't have good tools for, well, we have good tools, but often the tools are being misaligned for the children in the right age group. So there's still a lot more discussion that needs to happen about what tools should be used where for vision and for hearing in low resource settings. And again, the need to do it universally because we're also seeing where only certain children who are suspected of having a hearing or vision challenge are screened, and then that loses a lot of children who actually would benefit from additional testing. So the important thing is that screening is really the first step, and it's never intended to be the only step. Screening results in either further testing, so going to a medical clinic, getting their eyes checked or their hearing checked, to services or referrals in the community. I think there's a lot of concerns that there is a lack of referrals in a lot of the environments of what we work, but often there's more than what we think. And there's also a lot that teachers can do to modify their environment to support children in the cases where there are no vision or hearing services. When it comes to evaluation and for looking for challenges or finding out if a child needs additional support due to a cognitive or an intellectual disability, that's where it becomes much more challenging, especially when there's a lack of technical experts in the countries that we work in. And that should not be done with one singular tool. It shouldn't be done with a checklist. It's a much more comprehensive process that looks at children in a variety of settings over a period of time, looking at lots of different tools, and ultimately also engaging the parents in that process. And again, all of these things, the goal is what does a child need, what supports they need in the classroom, either accommodations, assistive devices, additional time, all of those things. What do they need to be a productive and be more included in the classroom? And the other thing I think is really important when it comes to screening and for all of these, the ultimate goal is inclusive education. So the last thing we would want is for screening or testing to become a justification for segregation or exclusion. But really the ultimate goal is providing the right supports to that child, going to an individualized level, and ensuring that they can be productive in an inclusive setting. And I'd be happy to, again, like my other colleagues, answer any questions that you may have.
Okay, thank you all. And now, if we can go to the next slide, please. So why are we here today? We're here to talk more in depth about this disability data collection. And as Mindy said before, to try to get input into a decision tree with which the USAID can provide guidance to implementing partners on how to select the proper tool for the proper purpose and what are the recommended ways for collecting data. Now, when we start talking about disability data, we recognize that it's very important for multiple reasons. It's important for motivating policy, for developing policies, for implementing them, and then for monitoring that implementation and evaluating their impact. So there's many different purposes for collecting disability. And disability itself is a very complicated concept. There's a lot of complexity in the type of disability, the degrees of disability, and as we said before, the number of purposes. So we need to really sort all these things out to make sure that we're aligning that disability data collection methodology with the purpose. And the purpose of this report was first to map how implementing partners, IPs, of USAID are currently collecting and using such data to get a sense of what's going on in the field. And then, as I said before, make recommendations for how best to align that data tool with the purpose of the data collection. The next slide. So when we talk about disability tools, it's important to distinguish between tools that are based on a medical model and the social model. As many of you are probably familiar with these two models, but just briefly, for those of you who may not be, the medical model lodges disability within a person. A person has a medical condition, a diagnosis, an impairment, and that is seen as what disability is. And therefore, all of the emphasis is on trying to fix the person, as opposed because that person's poorer outcomes, say less access to education or employment, or more likely to be poor, or a victim of violence, or whatever the outcome indicator is seen as stemming only from the person's medical condition. But the social model of disability is very different. First of all, it recognizes that human functioning exists along a broad continuum. And with the level of functioning we have, we interact with an environment that has various barriers to participation. And what disability is something that emerges when a person's personal functional limitations, maybe because of an impairment or a medical condition, meet barriers in the environment. And it's those barriers that are the cause of the exclusion. And so policy shouldn't be just directed at trying to, quote unquote, fix the person. The policy should be directed at making sure the environment is fully inclusive. And when we want to identify somebody with a disability for this purpose, as Claudia mentioned in her presentation, what we're trying to do is identify those people who, because of various functional limitations, are at risk of having a disability in the social model sense when they're confronted by these barriers. Next slide. So the medical model I described before, there's two general ways of trying to collect information on it. One are medical questionnaires, which consist of questions to individuals about their medical conditions. So you're given a questionnaire, or you have an interview where it says, do you have diabetes? Do you have autism? Do you have epilepsy? And things like that. Now, there are reasons for having medical questionnaires. There are purposes for collecting such information, but those are purposes for medical interventions. They're not purposes for thinking about disability and inclusion. Medical screenings are assessments that are done on individuals to identify and diagnose their medical conditions. So there we have, instead of asking someone if they have hypertension, and as you would in a medical questionnaire, in a medical screening, I'd actually take your blood pressure and do various assessments and evaluations to try to come up with a diagnosis of some kind. Next slide. We can move to the next slide, please. Oh, yeah, I'm sorry, there it is. So, no, back one, I'm sorry. So the social model is more complicated, right? Because you have this interaction between the environment and the person's characteristics and the person's functional limitations. So when we need to collect data in a social model context, what we need to do is collect data of the various components of the social model and then analyze them together. So when we talk about disability data collection in a social model framework, we're talking about collecting data on functioning, which is one component of the social model. One component is a person's functional limitations. And there's two ways of collecting this data. We can collect it through functional questionnaires, like the Washington Group short set, the child functioning module, the child functioning module teacher version, which consist of questions about difficulties doing various basic activities. And if you have a difficulty doing one of these basic activities, like seeing, hearing, communicating, that puts you at risk of facing barriers to participation, right? So that puts you at risk of being disabled in a social model sense. A functional screening is looking at the same thing. It's looking at person's difficulties doing various activities, but it's more detailed. It includes assessments of people's ability to do various basic activities. So instead of asking someone, do you have difficulty seeing? Maybe there's an eye chart test, which is actually trying to screen them in a more detailed way to try to identify that difficulty doing that activity. And we take this disability identification in this manner, which is identifying people who have functional limitations that put them at risk of exclusion. We combine that data with environmental data on barriers in the environment, be they attitudinal, infrastructural barriers, or whatever, and participation data. And we take these three types of data, functional data, the environmental data, and the participation data, and we use these together in a social model analysis. So we can see, oh, people who have difficulty walking, when they live in an environment with discrimination and poor, inaccessible transportation, have worse outcomes. They're less likely to go to school or to work. We combine those things together. Next slide. So we already talked a little bit about the Washington Group short set, which is, again, short. It's designed to be as short as possible, but it's a functional questionnaire. This child functioning module, which is Claudia described, covers a much broader range of functional areas, in particular those that are very important to children. And so does the child functioning module for teachers, although it's adapted, as Mitch said, in certain ways because we have a different respondent in a different type of setting. Next slide. Okay. So, and as Anne was saying, we also have these screening tools. And the screening tools were things like the hearing test, the vision test. It could be actually having a bunch of steps that you walk up to see if the person can walk up the steps. But it's actual screening tools that someone administers to the person to actually measure and identify the kinds of difficulties they may have doing these basic activities. So it's a different type of data tool. Next slide. Okay. So the objective of this study, which was undertaken by Deep under Amy's leadership, was to gain a better understanding of which tools IPs are currently using, one of these four types we just talked about, or maybe other types, how they're applying these tools, and what lessons we can learn from these applications. Where are they working well? Where are they not meeting their need? Where are their implementation issues? And what are they? And the idea is to collect this information to inform USAID guidance on generating data disaggregated by disability status. So to give the IP some guidance on which tool to use and how it could be administered. So the approach to the study was first to collect and review all the data survey tools, protocols, and finding reports from the IP. And then we had an online questionnaire that some of you who are listening to me right now completed. And then we had individual follow-up discussions with other members of the team. with the IPs to learn more about the challenges and solutions. And finally, we had a small focus group discussion to get a sort of deeper understanding of where the shortfalls and advantages and where the challenges and successes were in terms of collecting data using the tools, and where they maybe fell short, and where they and what were successful implementations that could be replicated elsewhere. Next slide. So of the implementing partners, you can see that almost all of them had a social model, had a functional questionnaire of the types we've been talking about. A few had medical questionnaires. In 3 out of 4 cases, they were done in conjunction with a functional questionnaire. And then there were 3 IPs who actually undertook a functional screening. So there was the weight of the experience was really in the functional questionnaires, but there were examples of people who had done other types of data collection as well. Next slide, please. And we asked everybody what their purposes were, and of the 13 implementing partners, there were 4 whose purpose was data disaggregation or prevalence, 4 who were doing individual screening identification, and there was overlap there. There were 3 who had both purposes, and finally there were 2 who, for the purpose of data collection, was for program and material design. Next slide. And what we're going to do is present with you a decision tree to try to figure out how to choose which tool is most appropriate for your purpose. So we'll be going through this in a little more detail in a second. But basically what happens is we start off with the purpose. What is the purpose? And then along the side, we have a bunch of factors, which, given my level of seeing, I have to move my screen away from me. The first is functional domain. After you decide on what the purpose is, then the next factor is what is the functional domains that you're interested in collecting? And then what is the data collection setting? For example, the school or the home. And then finally, what are the who are the interviewers, and where is the tool actually being implemented? I'm going to come back to this tree in a second. But the idea is we start off with the purpose, and then for each set of factors, you answer a bunch of questions. And in the end, it will tell you which tool is the most appropriate for you, given your purpose, given your the functional domains you're interested in, given the setting in which you're going to be administering the questionnaire, and given who the respondents are. Next slide. The next slide, please. There we go. So here are the broad purpose categories. They really fall into 2 main types. The first are individual child identification, and the second is prevalence and disaggregation. So under individual child identification, it could be trying to identify accommodations that are needed in a classroom, particular classroom, maybe referring children to medical screening. So this child is at a high risk of having a medical condition, or maybe this child is at a high risk of having a disability, and then referring them to get that more in-depth screening. Individual service provision, and finally individual grant provision, eligibility for a particular program. And those are individual type goals. And that's different from prevalence and disaggregation, where those are things like calculating the internationally comparable national prevalence rates. Is rate of disability in my area different than in another area? And also patterns of prevalence. Like, for example, I've recently been working on a bunch of data in South Africa, and the rate of vision difficulties is much higher in Limpopo, Limpopo, one particular province of South Africa. So knowing that the prevalence of this type of disability is much higher in this area is an important thing to know in trying to think about a lot of policies and programs dealing with a disability. A second is monitor progress in achieving inclusive education targets. So is the attendance rate of children with disabilities, is it meeting the target? Is it getting to be equal to the attendance rate for children without disabilities in the country, for example? Third, to inform program design, teaching and learning materials and pedagogic approaches. For example, the example I just gave of that in Limpopo, if I'm going to be going into Limpopo and having designing a program there, without knowing exactly which child has a vision difficulty, I might know that I need to particularly beef up the supplies and my ability to address the issues having to do with vision difficulties, because the rate is very high there, let's say. And finally, to measure the equity of program impact on children with and without disability. So I have an intervention, and I want to see, is the effect of the intervention equal for children with and without disability. So the next slide. So let's go back to, go back one more. Go back to the decision tree, there we go. So we're here back at our decision tree. So the first idea is, what is the purpose? On the left, you see the purpose might be individual identification for accommodation and services. Maybe that's the reason why you're collecting data. Then you would go down that side of the decision tree, right? Because that you identified your purpose. And now the next thing is, what functional domains are you interested in? Are you focusing on vision and hearing? Or is it the whole broad range of all types of functioning? How old are the children you're screening? Are they preschool age? Are they school age? Will you be collecting data at a medical facility, a school, or in the household? Because you might have a different type of tool depending on where you're actually collecting the data. And then going down from that, who will be collecting the data? Is it a teacher? Is it a health professional? Is it an interviewer? And then who is the respondent? As we talked about earlier, some of these question sets, like the CFM, are geared towards having a mother or caregiver as a respondent, whereas the CFM TV is geared more towards having the teacher as the respondent. And so your tool might differ based on that. And then going down there at the end, the idea is for the decision tree to say, okay, you've answered all these questions in this way, this is the appropriate tool to use. Now on the other side of the decision tree, it's the same thing. We start off with the prevalence. Data disaggregation is the primary reason, and again, it goes through the same factors: what functional domains, what's the setting, who are the respondents, who are the interviewers, and again, you get down to a particular tool. So the idea is, for this project is to finalize this type of decision tree. So next slide.
Thank you, Dan. I think the next slide introduces our next activity. So I do want to give you the chance to say anything else, and I also want to note that there was a question for Anne in the chat. So Anne, if you would like to respond to that now, please go ahead.
Yeah, I'm done. I mean, as you'll see, we're going to have another activity to get at to try to get your input into improving this decision tree. So that's all I have to say right now. So just Anne, if you have.
Sure. I think some of these questions from Diane and Megan and Sue are all a little bit intertwined on some level, but I think on how to assess children, Diane, your question for intellectual disabilities in low resource settings, and the involvement of many different people, ideally you would have parents, speech therapists, occupational therapists, a lot of these technical experts that just aren't available in many of these countries. And so in lack of that, then we have to start thinking what are the other options? And some of those things might include a variety of doing like a modified response to intervention to see if a child is struggling to learn because of language issues. Maybe they're not a native speaker. Maybe they're having challenges at home. Then you could see if that sort of intervention helps. Ecological assessments, so comparing how children are doing things compared to their peers is an option. And then, of course, like parent engagement is a really core element throughout. And I think, Sue, you brought up a question of the sort of confusion between developmental and intellectual disabilities, which is often not even understood in high-income countries. And I think that's true. That becomes a real problem when you are trying to self-identify. And Megan, of course, and when you mentioned how do you do autism as well, and I think this is sort of our big gap. I think we don't, vision and hearing are the first things to do, and yet we have real evidence to show we're not actually doing that even well. We're using tools for children that are unvalidated. So I think how we get to this next level, how we do it credit for understanding if a child is having a communication issue, which is one of the core elements of autism, if it's because they don't know the language or if they're autistic. These are things we really need to look at, all again with the idea of keeping children in school. And I think that also there was some discussion here about severity, and I think we need to be a little careful of severity and how we would do this as practitioners, mainly because many of the countries in which we work have policies that say that children who have severe disabilities should be educated in segregated settings. And the one thing we wouldn't want to do is to remove a child from the classroom, or in many cases that would mean removing them from their families, because the only places would be exclusion. But I think knowing where, especially with blindness and deafness, what sort of challenge they have. But again, we want to move away from this understanding that only severe deafness would need sign language, because many people who might be considered moderate would benefit from sign language. Same thing with Braille. Many children in that moderate range would benefit from Braille, many wouldn't. So I think there's a lot more, so much more work to be done in this, so much more discussion. I think at least we have the first part of the discussion, which is understanding how that the Washington Group tools are really effective for the purpose they were designed for. And then as far as we get to the child with the individual, there's significant more work to be done.
Thank you so much, Anne, and thank you to all of our speakers, Claudia, Mitch, Anne, and Dan, for presenting this initial information. And with that, we're going to move into our discussion around the decision tree. So as Dan mentioned, he walked you a little bit through the decision tree and how it's possibly used. And so our next activity asks all of you to be looking at the decision tree and thinking about how we might be able to use this decision tree going forward. Keep in mind that these scenarios are exemplary, and we recognize that they don't necessarily represent every single purpose for utilizing data. But we're really using the scenarios as a jumping point to be able to ask these two questions. What are some of the factors that you're taking into account that aren't currently captured in this draft decision tree? And what factors are included in the decision tree that you think will be useful for future decision making? In just a moment, we're going to be moving you into a breakout room. And in that breakout room, there will be a facilitator available to help you to have a discussion. You can have that discussion by utilizing the chat box. You can also come off mute and share your ideas. The scenario is available to you as well as the image of the decision tree. And you should also have the decision tree available to you. It was sent to you by email, so if you need the decision tree to be a bit larger, we welcome you to open that document now to have it as a resource. And the discussion is really to think about that decision tree and to think about what works and what doesn't. So you're welcome to have a discussion, take any notes for yourself, and then following that 15-minute discussion in your breakout room, everyone will have the opportunity to share their ideas either through chat boxes or through a large plenary discussion. Based on your inputs, we will be working on that decision tree to add additional information or to correct any information that you think may need to be improved upon. So we are looking for your feedback in order to build this decision tree out and to really make it useful for you as partners to USAID. So in just a moment, you'll see your screen shift. You won't need to do anything. Our producers will be there to support you as well. So I welcome you into these breakout rooms. Hello, can I have your attention, please? I realized that people were having very rich discussions when we moved you out of the breakout room. So if you wouldn't mind putting yourselves back on mute, the conversation will continue. So as you were discussing in your room, we're really trying to identify factors that were captured well, maybe need some adaptation, or factors that were not as well captured in the decision tree based on your scenario. The scenario is really, once again, just a jumping point, and we really welcome any feedback that you can provide us based on your discussions as well as any additional thoughts you had in the room. So we welcome you now to share those in the chat boxes on the upper left-hand corner of your screen. So please start entering any ideas that you had regarding factors that were not captured and need to be captured in this decision tree, as well as useful factors and any modifications to those useful factors. We also welcome you to come off mute to share any ideas that you had while in the room that you would prefer to share out verbally. So please come off mute. You can do that by either going to the top of your screen. You can see there's a little human figure, and you can click on that human figure and raise your hand if you'd like to come off mute, or you can just go ahead and come off mute. Carmen, I see you. Please come off mute and share your idea.
Great, thanks, wonderful. So breakout room 1, I think, had a super constructive conversation about some of the decision factors that are not captured and several that are really cool that are there. Maybe one that I want to highlight is that we felt that maybe consideration should be given to a last band of factors underneath tool, which pertains to aspects of follow-up. So after tool administration, you might also have decisions that relate to your tool about the degree to which data may need to be fed back, say, to families, school administrators, and that might make a determination in terms of what tool to use. And the other one is also considering what tool you use and what you're focusing on in terms of what follow-up services might be available in the context as we're raising expectations doing these kind of screening or prevalence rate efforts, that potentially also some follow-up services and support is being provided.
Thank you so much, Carmen. Anyone else? Feel free to come off mute and share a little bit more. Mitch, please go ahead.
We were a very small group, but we had an interesting discussion, scenario 3, that looked at determining barriers to attending school for children with, in particular, anxiety and depression. One of the things that I thought was interesting in this particular scenario was that it looked at barriers to attending school, which is something that wasn't really included in the modules we talked about this morning. Just to clarify a little bit, the tools that we talked about this morning, in particular, the short set, the child functioning module, and a version for teachers, identified children who would be at risk of not being able to participate in an unaccommodating environment. So we could identify children with and without disabilities per se, but we wouldn't know what the reasons were for their not attending school. So I brought up the near completed inclusive education module that the Washington Group and UNICEF is working on that would get at barriers to education. So in particular, focusing on out of school children with anxiety and depression that are perhaps the main reasons for their functional difficulties, and then looking at the barriers through something like the inclusive education module.
Thank you so much, Mitch. Any other ideas that came to light in your breakout rooms that you'd like to share? Please feel free to come off mute and share anything that came up in.
Hi, this is Leah. Can you hear me?
Yes, please go ahead, Leah.
Thanks, Mindy. One of the things that came up in our discussion room, and Nafisa just alluded to this in the chat box, was that there may need to be recognition that that a tool has dual purpose. And so for the purpose of the decision tree itself, there was a recommendation that our group discussed about making it clear that the decision tree may be used more than once. For example, if you have a primary reason for collecting data, you may walk through the decision tree thinking through that primary data use, and then you may walk through that decision tree a second time if you have a secondary use for collecting data. So the recommendation was to somehow make that explicit in the decision tree about its use itself and how it can be used more than one time if you have more than one purpose for collecting and using data.
Thank you. Great idea. Tom, please come off mute and share.
Yes, in our group, given our scenario, we were looking at more of individual identification for accommodation, talking about looking at vision screening and audio screening in a school in Nepal, and our discussion related to the fact that it is very important to have some community mapping or some research done beforehand to determine what are the resources, where can we refer students when we find them. If we're going to go through the process of identifying a specific need, then we should be ready already to point them to the right accommodations, which are not always easy to find in some places, but as Anne pointed out to us from some of her research, there was a lot more there than might have been expected when looking at a place in Tanzania. And then we definitely overall thought with that side of the tree, identification for accommodation, it needs multiple more levels. It needs to get down to where, as it says, what functional domains are you screening, then it needs to open up and what are we doing, whether we're looking at the different domains so that we can get to specific tools or test tools that would be used for the different purposes or the different things we were looking for so that we can be specific about what accommodations we can then provide.
Thank you, Tom. Carmen, yes.
Another aspect that we discussed in our team that I think pertains to sort of both arms is it's also not about the setting, but also sort of the human support that is available, as well as what kind of consent can we expect to be getting. Children, that are in a setting where they may not have a primary caregiver, parent, or even a school director around, may also influence the type of tool you can choose, given what kind of consent and ethical approaches to collecting these data you might be able to do.
Thank you, Carmen. Anyone else like to come off mute and share a bit more? You're welcome to go to the top of the screen and click on the human with the raised hand, and that will let me know that you'd like to speak. I also welcome any of our technical experts to come off mute and ask any questions regarding what's been shared in the chat boxes, or to share any additional questions that might be posed to the group regarding the decision tree.
One thing that was raised in our group was there a need to collect data from more than one type of respondent in order to triangulate the results in order to better understand the results? So knowing what a parent said and a teacher said, and are they the same? And if they're different, that also gives you more information. And so there might be more than one type of respondent.
Thank you, Daniel. Anyone else like to come off mute and share a bit more about their ideas? I see a few questions in the chat boxes as well that you're welcome to respond to if you see something that someone else.
Hi, it's Mitch. I'm really kind of old school, so it's hard for me to read two chat boxes and listen at the same time. But I am making my way through this. I wanted, first of all, to sort of endorse what Leah said about sort of a multi-purpose approach to the decision tree. I think that's important, and that kind of feeds into what Dan was saying as well about triangulating and looking at different sources of data. Again, referring back to the scenario we had on barriers, it may be important to look at what a school, in our case it was Dakar in Senegal, what schools have available for individuals with certain kinds of functional limitations, what kind of barriers, physical barriers, and even maybe attitudinal barriers exist. So it's a different kind of data collection, but in order to get a holistic picture of what there is on the ground, you may need more than one source of data, and I think it's important to keep that in.
I just wanted to point out that although I agree with everything Mitch just said, maybe it wasn't clear enough that the decision tree was a decision tree for choosing a tool to identify children with disabilities. That's only one small part of the information we need. We also need the information on the environment and the barriers as well, and that's what Mitch and other people have brought up, and that's vital for determining what types of interventions we need, what types of policies we need. You know, where are the barriers? That's really important. And it maybe should be made more explicit when we present the tree, that the purpose of this tree was for how to choose a tool to identify children with disabilities. Yeah.
Thank you for clarifying that, Dan. And I see Kwok has a hand raised, and then after that we'll turn to Hetal. So Kwok, go ahead.
Hi there, my name's Kwok. Actually, I was just, I put my hand up because no one else from the group had, and then Hetal's put her hand up, so I don't know whether I'm going to be saying the same things. I don't know if I want to. I'll go ahead anyway. There's a few comments that we typed in our group. Our group was looking at a situation of humanitarian crisis where there was refugees. And I think one of our questions was actually of those options of the questions to ask. Before we can identify the purpose, we need to ask what can we get, what reliable sources can we have in terms of collecting the data. So that's where we've mentioned about changing the orientation of the tree, because you know, the sources of information could be quite limited if we don't have access to parents or don't have access to teachers without any prior experience with the children. And then just as a summary, I suppose that we also like the idea that the tool may want to lead to another outcome, as mentioned just by Daniel recently, that if I'm just wondering about how that would appear once you have a decision tree, because maybe it's the word tools that actually may need clearer definitions of what that could possibly be, rather than an extension and another box that leads out from that. And I also like the idea of it being used multiple times, because I was actually wondering whether there would be how would they link closer together, but I suppose you can do it more than once. I think, yeah, the example of this humanitarian part might be quite different, given that background information is largely a mist, and I think that could be something that may may need addressing that, really.
Thank you very much. Yes. Yeah, that was a very challenging scenario, and I'm sure it led to a great discussion that brought out some of the good questions that you're asking there. I don't know if anyone would like to speak to that before we move on, or if we'll move on to Hedel next. Anyone like to speak to Kwok's concerns? Okay, if not, we'll go on to Hedel. Please come off mute and share your thoughts.
Sure. Hi, and thanks, Kwok, for bringing that up, because I actually had a different point. Just to follow up on Kwok's comment, that I do think thinking about it from the tools perspective and then driving down to purpose is really helpful, because we can commit to a purpose and then realize that the data we collect aren't good enough for that purpose, and so you have to rethink how and where to responsibly use that information. The point I was going to make is an example that this idea of repetitive use of the tree, I'd even say repetitive use of the tool. So an example is we were doing prevalence data collection, and we first collected information using the short set from students, and found almost like a 25% prevalence rate of one or another disability, so at least one disability among the population. And we went back to decision makers, and they said, there's no way this is correct. This is crazy. This is too high. And so we were asked to redo the collection, and this time we used the child functioning, and we asked it both of students and of their parents. And between those three data sets, we had hugely different results, even at the individual level. So these were the same individual students over across all three data sets. And we just couldn't figure out which one to believe. And when we used the child functioning with the parents and with the students, it was more around 10%. So an overall huge difference in the prevalence rate from 25% to 10%. But then also within students, there was discrepancy. And then when we looked at which particular disability groups there was this discrepancy in, it was all over the place. It wasn't always with with the cognitive disabilities. It was also with the physical disabilities, with seeing. So it was really hard as people collecting the data to know what was driving that difference. Ultimately, we just picked one that made sense based on what the funder wanted and what their disability experts suggested that we prioritize. But I'd be curious to think how the group how can that be addressed in the decision tree, because if you pick a tool, you can come up with a particular prevalence rate, but is that accurate, or should there be some triangulation across multiple tools?
Thank you so much for that really rich question and story, Hedel. Dan, I would love for you to come off mute and share if you have any comments related to Hedel's question. Please feel free to share in any of the chat boxes, whether that's the main chat or any of the others in response to her idea. Go ahead, Dan, and then we'll go to Edward after that.
Okay, just quickly, I like to talk to both Kwok and Heddle. First, in terms of putting the decision tree the other way, that makes sense if you're looking if the idea is you're looking at data sources that already exist, right? Someone has already collected data, and you're trying to decide what use is this data that somebody has already collected. Then you can go sort of back the other way and decide, okay, given they collected the data this way, how could I use it effectively? But if you're going to collect data, the whole point of the decision tree is to say, I have this purpose. What tool can I use so that I can meet my purpose? Right? That's the whole idea. But to the Heddle thing, it's interesting that you found it that way, because usually it's the other way around. The watching group sort set misses a bunch of children who have certain types of disabilities, like psychosocial disabilities or learning or developmental disabilities. And actually, there was someone in our group from Albania who said just that. When they used the watching group short set, they did not identify all the children that the CFM can identify. So your experience in the other direction, having the watching group short set identify a lot more than the child functioning module, is really unusual. And I'd like to talk to you more about exactly what was going on there. But remember, and Claudia maybe can speak to this, the child functioning model was developed, designed, and tested for mother responses, not for child response. And we have reason, and there's reasons for that. And so we don't think, it has not been validated and tested for children. So it was for the mother's response. So that's the one I would use. But the fact that your results were flipped with the short set and the child function model is really intriguing, and maybe Claudia and I would like to talk to you about that more to see what was try to figure out what was going on. Claudia, I don't know if you have something you want to add.
Yes, thank you, Dan. Indeed, I would love, Hetal, to hear more about your work. And as I mentioned in the chat, we are going to be doing together with Dan and Mitch and Filippa, who is also connected, and many others. And of course, if you're interested, we will be happy to involve you as well. We will be doing some methodological work to really test the child functioning module and how it performs when it comes to implementing it in school setting or with teachers as part of EMIS, for instance. So we are still trying to respond to some of the questions about validity and reliability of using the child functioning module with respondents others than mother and the primary caregivers. When it comes to comparing results of the child functioning module between parents and children, the Washington group and specifically the cognitive testing lab within the National Center for Health Statistics did testing of the child functioning module when we were still in the process of development by applying the child functioning module on parents as well as on adolescents age 13 and above and compare the results. The report is available, and it's available in the cognitive testing data bank of the National Center for Health Statistics. But what we found out from that exercise that were actually high level of correspondence between the answer given by parents and given by adolescents for most of the domains. There were, of course, some domains where the parental assessment versus the child response were different, and were more domains related to relationship, for instance, or anxiety and depression. But the discrepancies were not as such to influence the calculation of our indicator. Because, for instance, parents were saying, my child does not have any difficulty making friends, and the adolescent was reporting some difficulty. And for the calculation of our indicators, we normally report on the percentage of children for which the response was cannot do at all or a lot of difficulty. So just to say that, again, some of this methodological work was done. Of course, it was limited to the example that I provided. But overall, it seems as if when the child function module is applied between adolescents and their parents, the response are not too different. But we haven't done a system review between the parent's response versus the teacher response. And this is what we will be doing as part of this methodological work that I mentioned.
Thank you, Claudia. I see quite a few questions in chat. I want to make time for Edward to be able to come off mute and share his thoughts, and then we could certainly go back to those questions that are in the chat box. So go ahead, Edward, first, and then we'll go back to Claudia to answer questions.
Hey, thank you very much. Just wanted to reflect some of the discussion in our group, and particularly it was around probably needing to incorporate something about the resources that might already be available in terms of existing studies or research that could inform, and we were looking at early grade reading and prevalence. So we want to know that, but also in terms of financial. I mean, obviously, you know, to do a prevalence study if there's not one available would have a significant investment, and that may be something that could be integrated into kind of, I know mandatory gender analysis is part of USAID's programs now. Perhaps that might be included within that, or at before the development of the RFA or RFP. And the second thing I think that needs to be thought about is exactly how the relevant impairments that we're interested in. And I think one of the questions that I posted this in the chat, one of our colleagues from Albania did some research that identified that a lot of kind of learning impairments were much more significant than those physical impairments. So if we're obviously not addressing them in our programming, then it becomes less relevant to measure them. But if it is relevant to measure them, then we need much greater investment potentially in that. So I do think, you know, and Karen had mentioned from Creative that obviously in the current baselines that we're doing in our programs, they often only look at they're the early grade reading assessments, and even those that aren't looking at maybe Braille or sign language. So there are some weaknesses in what we currently have. So that's really the challenges we laid it out that I think could be better integrated into that tree, and maybe some examples of existing studies that may exist that could inform then the decisions lower down. Okay. That was all.
Thank you so much, Edward. And Claudia, would you be able to speak to some of the questions that were in the chat in the case that they hadn't been answered already?
I'm still catching up with all of them, so if I can have a little bit more
Sure,
time.
I can give you a couple more minutes. I did have a question for a comment that was made by Sue Swinson, and I just would love a little bit more information. Sue, if you don't mind coming off mute. You mentioned in the factors not captured the idea that isn't it discriminatory to screen only for vision and hearing problems when the purpose is accommodation? What happens to children with other disabilities? So first, just to say that the scenarios are only exemplary. So if you were speaking to the scenario in and of itself, maybe that explains things. But otherwise, would you mind coming off mute and clarifying your comment?
Yeah, I was speaking to the scenario itself. And so a couple of things. If you're going to be testing children, the test has to be accessible to children with intellectual disabilities if it's going to be valid, whether you're testing for intellectual disability or not. So vision screening and hearing screening have to take into account that some of the children you will be testing probably have intellectual disability. But if the only thing you're telling the school district or the place you're going is, well, we're going to come in and measure kids for hearing and vision problems so that they can be accommodated, that's where I start to have a problem with discrimination. So it begins to, the unspoken lesson is that these are the most important children to accommodate, or whatever. And I saw another person make a comment that most children have more than one disability, and I believe that that's true, and I just don't know how you would run something where you pick out only some disabilities to screen for and tell the people around you that you're only going to accommodate those disabilities. It seems to me that would be a jump. So, but that was just in the scenario. It's not meant to be a common comment on what's going on in general.
Thank you so much. And Anne, I would love it if you could come off mute and share a little bit more insight in.
Sue, I totally agree. In fact, that was the first comment we had when our scenario said you're there to identify vision and hearing. And I think what's challenging and something we need to hit the right balance is that vision and hearing needs to be ruled out first before you can do any other sort of evaluation or screening. Because it's a child having a hard time understanding content because they simply can't see it, or because they're not having a harder time processing it. But I think that can lead to the danger that people assume that's where it ends, and that's where it needs to not end, to make sure we're giving all of those supports. And this is also where I think the other thing too is using the right tools, not just for the child, but a tool that would allow for children with disabilities. And I think we see that with some of the vision charts. You know, LEA is much better for children with disabilities. The tumbling E is hard for children with intellectual or dyslexia because of orientation. And then, of course, letters is a challenge if you are not have an intellectual, but also if you're age 5 or 6 and you may have not learned those letters. So finding the right tool, I think, really needs to deep dive, and then also understanding that while vision and hearing is often the first step, it can't end there.
And sometimes
Thank
there's
you
a
so much,
misunderstanding.
Anne. Yeah, thank you, Sue, and thank you, Anne. We have about 8 minutes left for our debrief. So I welcome you to take one more peruse through the factors not captured and useful factors captured, as well as our main chat box, and welcome you to come off mute to share any additional thoughts or to add them to any of our chat boxes. I also welcome any of our resource people to come online and answer to any of the questions shared in the main chat box, if you'd be willing. So I see a few things shared that people were asking about. If you'd be willing to come off mute. Claudia.
Yes, thank you. I think there was a point made by Tom about identifying children who are out of school and what instrument we should use for that, and as opposed to, for instance, using the another instrument for teachers. I mean, if we think about the issue about purpose, a household survey, I think is well placed to give a sense of the population of our children and whether or not they're currently attending school, not attending school, and whether they have functional difficulties or not. So in a context of a survey like a MIPS or a DHS or any national survey, we can have a situation where we have a module about education, as well as a module on child functioning. And I think, again, as mentioned at the beginning, between choosing between the child functioning module and the Washington group short set, the preferred way should be the Washington group UNICEF child functioning module to identify the population of children with functional difficulties. Now, when this information is collected together with information about education, we are going to be able to disaggregate and understand the proportion of children with disabilities, for instance, who are currently out of school. And we will also be able to disaggregate a number of other education-related indicators by functional difficulties and see whether children with functional difficulties are less likely to complete primary or secondary school, etc. Then, of course, when we go at the school level, we have to again think about what will be the purpose of using the child functioning module with teachers. Because we can, of course, use multitude of different sources to validate, triangulate, and have a better sense of the situation of children with disabilities. But we have to go back again to the purpose of why we will be using the child functioning module, for instance, with teachers, as opposed to using tools for a direct assessment of the child. So just again, a point of really the importance of determining purpose, because we can have multiple data sources for multiple purposes, and we can combine these different set of information that we obtain to come up with a more comprehensive picture of the situation of children with disabilities.
Thank you so much. I'm wondering if anyone is able to speak to Tom Sabella's question. He writes in the chat box, it's very important to collect data about both children out of school, which the WGSS used in household survey will provide, and as well as those in school, which the CFM for teachers may provide in order to have realistic data about the population. Too often children with disabilities are excluded, and we must have data which illustrates the need to include those children. Is there a way that both can be used at the same time but fused together to produce accurate data? Daniel, please go ahead.
It brings up a good point that data is collected in different settings, and if it takes the same approach to identifying functional difficulties, then those data can be used together, and they become more valuable. So, for example, if there's a household survey that uses the child functioning module to identify children with disabilities, and that gives us a lot of information about whether the child are in school or out of school, what the home situation is like, what the living conditions are like, et cetera, et cetera. And then there's data collected, let's say, in an education management information system, that's administrative data, about what's going on in the school. Well, if the way you're identifying children is the same approach in both data tools, the EMIS and the household survey, then they can be used together, and you can say, okay, these are the children with these types of disability in school are, generally speaking, the same type of children with those types of disabilities in the population, and we can make those comparisons. But if the two tools, let's say the EMIS asks a question like, does a child have, let's say the EMIS takes a medical approach to determining, whether a child has a disability, but the household survey takes a child functioning approach. Well, then we can't use the two data sets together because they're not conceptualizing disability in the same kind of way. So it is important to have a consistent approach to how we identify this. And even if you're doing something like you have the Washington Group short set and the child functioning module, well, on a census, you're never going to have the child functioning module because it's way too long. But you might have the Washington Group short set. And we know that the Washington Group short set under-identifies children with certain types of disabilities. But if we have a household survey with the child functioning module, and it's taking a functional approach, and the Washington Group short set is taking a functional approach in the census, we can still understand the relationship between the two and have an estimate of how much the Washington Group short set is underestimating of what types, but still be able to use the two data sets together to make inferences using the census data. So the key thing is to have a consistent approach, and I would say consistent functionally based approach to collecting data on children in across all the different types of data tools so that they can be used in conjunction with each other.
Thank you, Dan. I'm wondering if anyone can speak to Hedel's comment in the main chat, and then following that, we will be finalizing our discussion for today. Hedel is speaking to whether there will be further details on how data should be reported for each. And I think she's referring to the comment she made above. I'm not sure if Daniel or Claudia.
Yeah, well, once again, it goes to the purpose. So if the idea is to sort of benchmark of what let's say the rate of out-of-school children with disability is in one country versus another, then we really think that the lot of difficulty cannot do cutoff is the one that's internationally comparable. However, if I'm working within a single school a project and I'm trying to identify children who might have difficulties that are getting in the way of their having learning success, I might want to also look at those children who have some level of difficulties to see if their outcomes are also different, if they are also facing barriers. And because the idea is we want to address all children's inclusive education really is about all children's needs, regardless of whether we say they have a disability or not. Every child has certain limitations. Every child has certain challenges and certain strengths, and it could be that that looking at all levels of functioning are important when trying to figure out what we should be doing in that classroom in that school. But if we're making international comparisons, we want to use internationally comparable data. If we want to compare our data to data that's being collected by a different survey or different, then we want to use a different cutoff. So the cutoff that we use for identification also can change based on the purpose of the data collection.
Thank you. Mitch, please go ahead.
Yeah, thanks. Just to follow up a little bit on what Dan said, I think what we have to also do is look at what the scope of the data collection is. What is the scope of the work that you're doing? And it goes back to the purpose that the Washington Group created some of these tools. We mentioned at the beginning that they're for large national representative surveys. But what we're talking about are a lot of times children, sometimes individual children or school settings where we want to, in a sense, adapt the tools that we have to collect information on children and look at what accommodations they have, what is in the school that provides inclusive education. And it's that step of looking at the tools that are available and adapting them or not changing them or anything like that, but using them for a purpose that is slightly different than was originally intended. And I think that answers a lot of the questions about identifying children, identifying barriers, and looking at this triangulation of teacher, school, home, parent. That's more than triangulation, but to get a holistic view of a child and their functional ability and the resources that are available.
Thank you so much, Mitch. So we are going to be closing up our conversation for now. I see a few more questions and thoughts in our chat box. We will certainly get back to you by email with any information that you may be requesting. So with that, let's move to our final screen. And I am going to first go into our next steps, and then I'll be inviting Josh to share some closing remarks before we end our session. So if I can have the closing slide, then we'll be able to go into next steps. So as you know, we drafted a decision tree for your consideration for this session. And so we will be following up on that decision tree by incorporating the ideas that you have shared in the previous session. Once that draft decision tree has been remodeled based on what you've shared, we will be sending it to you, and we will be asking for you to share it with your teams back at your home organizations to ask for further input. When we have our next session in June, you'll have the opportunity to give your additional feedback to us, which can then be incorporated into the session notes or into the draft decision tree. So we'll be looking forward to receiving more information and more feedback from you as you go forward. In the upcoming session, we will then be able to further test the decision tree, and we'll be looking into tools to be able to determine what tools we may be missing and maybe where we need to create new tools to meet the need for data collection. And with that, I would ask Josh to please come online and share your closing thoughts with the group. Much appreciation.
Hello, wow. It's interesting to learn from different presenters about the history of the Washington group questions, the different challenges that different groups are facing in terms of data collection on disability, and why it's so important to do consistent screenings. And this is a process. It's the first step in the process. It's all important information to be able to gather from you. And it's interesting to find different approaches and tools that we can all learn from. But right now we're looking at the decision tree. We're taking that apart. And I want to emphasize that there's a lot of shared understanding in terms of the purpose of the tools, and that it's very important to have your purpose in mind when using this decision tree to find the tools to best suit your needs. And the final goal is to collect disability data to encourage more inclusive education for children with disabilities to be included in the classroom. The disability team here, along with Compass, we are jumping with joy. We are so thrilled to see how many of you are participating. And we did have a concern about this, but we were so happy to see all of you who turned out today. Mindy and the rest of us will be using this information going forward to inform future sessions. And altogether, I think it's going to be a great meeting to use tools from to use as a tool going forward globally. So thank you to all the presenters today, everyone who was here. Thank you so much for making this a successful webinar.
Thank you so much, Josh. Once again, from our team at USAID and the DEEP team, we so appreciate you being a part of this session, and we look forward to meeting with you again on June 4th. Once again, we will be sending an email to give further information about the follow-up session and any asks that we have collected from this session. So thank you once again. Have a lovely day.